if you look over this the city, there's women's health everywhere. But where's their men's health? All I see is testosterone clinic. Well, testosterone is less than 1%, if even that, of what men's health really is and what we really do. So men's health is, I'm going to give you an example. So if a guy has chest pain, which we all know that the number one killer of men is heart disease. If a guy has chest pain, he's just going to attribute it to, maybe I was lifting a little heavier yesterday. Maybe I was cutting the tree, whatever it may be. Man has this macho, persona that they have to keep, and they don't seek help. And so what ended up happening is they neglect their health. And so what, the difference between women and men is that, let's just say Sarah has a lump on her breast or something. She'll ask her best friend or whoever, hey, Jenny, can you take a look at this? What do you think? Jenny would probably be like, Sarah, I don't know. That doesn't look right to me. Probably should go see a doctor. And I guarantee you Sarah's going to call the next day, make an appointment, get in, and then they'll probably do a mammogram or whatever it is they do. Versus, I can tell you from personal experience that, let's say Brian has a short penis and he's gonna go, hey, and then he just happened to be at the bar and he's kind of urinating, looking over. It's like, man, what the heck? Man, what the hell? I'm 5'11", and then so he'll go up to Peter. It's like, hey, Peter, man, can you take a look at my Willy Wonka and see, like, does that look normal to you? I guarantee you Peter's gonna be like, man, what the hell? Hell no. I'm not looking at anything. You on your own. And so so you get what I mean? Or like if Brian can't get it up or it's softer and he asks Peter is gonna be like, I'm not answering anything. And so you see the difference between how men and women are built. And so the goal of my show is to educate men that, hey, listen, what you have is not something to be ashamed of. And most likely, if you can't get it up, it's because you probably have some underlying kidney issues or cardiac issues or whatnot. And it's important to go see your doctor. But men don't know that.
Love is priceless, take it to the moon. Priceless, one day will be soon. Love is priceless.
Hey everybody, it's Dr. Pham. So this is something I've always wanted to do, which was to have a show where basically we talk about men's health. And men's health doesn't mean testosterone or Viagra or Cialis and all that. Men's health is all encompassing: kidney, liver, whatever it may be. And of course, this is one of the things I really enjoy is, and that's all I kind of do, is fix penis. And so, it's not a glamorous thing, but it is a very important thing. And that's why outside of work, when people ask me what I do, I said I'm a brain surgeon for men. There's nothing sexy about, I fix penis for a living. That just doesn't sound right. So the show, this is an introduction to the podcast, and then obviously the YouTube channel that will accompany it. And then the production crew will help me put it on a social media platform. But I think, this show is going to be called D-Talk with Dr. Pham. And the whole goal is to really educate men on the importance of health and why, just taking testosterone and Viagra is not men's health. And so, an example would be what men's health truly means. And that's the reason why I do this show. Is just to be able to help men take better care of themselves and understand why it's important to at least see your doctor at minimum once a year. And so A perfect example is if you look over this the city, there's women's health everywhere. But where's their men's health? All I see is testosterone clinic. Well, testosterone is less than 1%, if even that, of what men's health really is and what we really do. So men's health is, I'm going to give you an example. So if a guy has chest pain, which we all know that the number one killer of men is heart disease. If a guy has chest pain, he's just going to attribute it to, maybe I was lifting a little heavier yesterday. Maybe I was cutting the tree, whatever it may be. Man has this macho, persona that they have to keep, and they don't seek help. And so what ended up happening is they neglect their health. And so the difference between women and men is that women, on the other hand, if let's just say Sarah has a lump on her breast or something, she'll ask her best friend or whoever, hey, Jenny, can you take a look at this? What do you think? Jenny would probably be like, Sarah, I don't know. That doesn't look right to me. Probably should go see a doctor. And I guarantee you Sarah's going to call the next day, make an appointment, get in, and then they'll probably do a mammogram or whatever it is they do. Versus, I can tell you from personal experience that, let's say Brian has a short penis and he's going to go, hey, and then he just happened to be at the bar and he's kind of urinating, looking over. It's like, man, what the heck? Man, what the hell? I'm 5'11", and then so he'll go up to Peter. It's like, hey, Peter, man, can you take a look at my Willy Wonka and see, like, does that look normal to you? I guarantee you Peter's gonna be like, man, what the hell? Hell no, no. I'm not looking at anything. You on your own. And so you get what I mean? Or like if Brian can't get it up or it's softer and he asks Peter is gonna be like, I'm not answering anything. And so you see the difference between how men and women are built. And so the goal of my show is to educate men that, hey, listen, what you have is not something to be ashamed of. And most likely, if you can't get it up, it's because you probably have some underlying kidney issues or cardiac issues or whatnot. And it's important to go see your doctor. But men don't know that. They just feel like their job is just to wake up in the morning, provide for the family, and there's this macho persona, which I don't even know how we even got there, but it shouldn't have to be like that. Men live on average 10 years less than women, and I really do think that has a lot to do with men just not taking care of themselves. And it's well known that men don't like to go to the doctor. They just feel like, I'm Superman, nothing will happen to me, and then next thing you know, they drop dead the next day. And the only one that hurts from all this is the loved ones that he left behind. And so my goal out of this show, even if I could help one guy live a better life and increase his longevity and live a longer life, and with a longer penis too, of course, then I think I would have done my job. And so this is just an introduction episode, but this will be part of a larger series on anything and everything. So it doesn't have to be about urology. It can be about finances. It can be about whatever. And so if it's topics that I don't, or not, like an expert in, then I will get someone on that is an expert who can speak more to that. So one of the things I would love it if, I mean, I can come up with topics all day long, and content for me is easy. I just show up to the hospital and there's content right there. That's why I love operating. Every time I show up to the OR, there's always something going on that just defies everything. I wish people can really be in the OR. just just the things that happen in the OR, not with patients. Of course, we take good patient care, but it's just comical to me, like just the way doctors act and stuff like that. It's just so comical. And so I don't, I know there's a writer strike right now. I don't need a writer. I don't need a content person. I just show up to the hospital, and that is my content. So anyways, I hope this show will help educate men on kind of everything and anything that that people want to talk about. Send in the questions, and and then periodically, probably once a month or so, I'll bring in a guest to discuss anything and everything that's in between. Anything and everything that's in between. And so if this episode or this series can even save one guy's life, then I would have done my job. And so by trying to educate men from the get-go, I think it'll really get them to fully understand, like, hey, it's okay, that what you have is not something that's your fault. It's something you were born with and you just don't know. So for an example, I've been doing medicine for 13 years, and I lost count, but probably more than 12,000 penis surgery. And I don't count circumcision as a surgery. And I can tell you, a lot of guys, when they come in or when they schedule the visit, they're so embarrassed that they'll just put down personal reasons as a reason why they're coming here. Normally, when I treat a child, the parents usually will put down exactly what they're there for, whatever it may be, twisted penis, curved penis, whatever it may be. It doesn't matter. Undescended testicle, they'll put it down. Men, on the other hand, is just to get them to even come see the doctor, it takes an act of God. But once they actually come in and see me, I try to make it humorous, so that guys don't feel like, this is something embarrassing. But when they leave, they're like, you know what? I'm glad I went. And for me, as long as they leave happy, that I know I did my job. And I can only speak to my practice, where once the guy leaves, I think he feels more confident. He feels like, this is something that correctable, and I should have came a long time ago, because I try to put humor in a serious topic, because that's the only way that you can get a guy to kind of open up. And so that's the point of me trying to do a show like this, because as busy as I am, I run 5 company, and just just the fact that I have to film on a Saturday just tells you like how busy I am, where it's just virtually impossible on a day. But I'm willing to do it, because for me, just the fact that, I took an oath to really practice medicine and, help the community in general. I think this is one of the ways that I can give back, is to really just educate men on all topics. So this show, this is just an introduction. But this show, the way I envision it, it would be, we would talk about everything from whole, life insurance to savings to, college to whatever, any topic. My goal is to talk about every single topic, not just urology, right? Because there's other urology shows that already exist. But what I'm hoping that this will separate is, we're not just here to talk about urology. We're here to talk about just all thing men, whatever it may be. emotional issues, depression, whatever it may be. And I'm not an expert at every single thing. And so my goal is, hopefully people watch this and send in topics that they would like discussed. And if I'm not able to provide the information, then I'll find a guest who can. So for instance, if they want to hear about prostate cancer, well, I'm not an expert in prostate cancer, but I can get somebody who is an expert in prostate cancer that can talk about it. And like I said, it doesn't have to be urology. It can be any topic. But of course, one of the topic that all guys really want to know, and I hate to say it, but I was outside of work when people ask me what I do. I tell them I'm a brain surgeon for men. No, if men really used their real brain, I think we would have world peace. Nobody would go hungry. But unfortunately, that's just not the way it is. So basically, a lot of it is going to revolve around penile conditions, penile issues. And the one thing that all guys really like is, or the topic that, in my experience anyways, is just penis elongation and how it works, success rate. Because as a guy, that body part is actually very important to us. It basically defines who we are, and from there it builds their confidence so that they can do whatever it is that they need to do. And this is just from personal experience when guys come in to tell me. They're like, I have a perfect example. Is I had a patient that he was on antidepressant. And, we all know that psychiatrists don't, really do like a full genital exam. And rightfully so, that's not what they specialize in. But I had a guy that was, I think he was around 19, something like that, real depressed, real withdrawn. And so he basically had a phenomenon called buried penis, and it was just very, very tucked in, where even at the erect state, it was 2 inches. And so he gets put on an antidepressant because it just totally destroys him. I mean, just imagine he's in college and, he's been living with this all his life. And so finally his mom was like able to kind of get him to kind of talk to her a little bit about like, hey, what is it that's really bothering you, that's causing you to have to take antidepressant and all this. And so finally he opened it up to her. He's like, and it took almost 2 years for him to open up to her. So that just tells you how sensitive the topic is. She literally told me that he finally said, I don't know if I'm like even a man, because down there it's just so short, and when I've seen my friends and it doesn't look the same. And so she's like, well, why don't so they went to their family care doctor, who then was like, you need to just go see Dr. Pham. So when I saw him, basically, I mean, he just looked, it's hard to describe, but it just broke my heart. And so I basically explained to him that what's going on really is your penis is normal size. It's just really stuck underneath. And it's very hard to kind of comprehend it, like how you actually, penis elongation. It's just really hard to comprehend. That's why, hence, the saying, pictures are worth 1,000 words, because once I was able to show him with pictures what I'm referring to, he underwent the surgery, and basically he went from 2-inch to 7-inch. And for 2 or 3 weeks, I mean, it just changed his life. I mean, he just kept looking at it. And of course, they were able to wean him off the antidepressant, because he was depressed because of genital issues. And now that that's no longer an issue, well, then he doesn't need the antidepressant. And antidepressant has a lot of side effects too. So he's just the most happy guy I've seen in a long time. And I see a lot of happy guys. So I called his mom one day just to check up on him. I periodically call patients just to check up on them, make sure that, they're doing okay, everything's good and all that. And his mom asked me, like, can you talk to him? I said, sure. Like, well, but what's the problem? She said, well, he's looking at it like all the time, and he just can't believe what he's seeing. And so I said, sure, Mom, put him on the phone. And so I kind of talked to him, and I asked him, I said, are you looking at it because you're not happy or what it is? He said, oh, no, Dr. Pham, definitely not. I've never been this happy in my life. And so he said he was more of like, is this something that is going to stay like that? Or is this something that's temporary that, it'll go back to being 2-inch? And I said, no, absolutely not. I said, what you see that's yours. You can do whatever you want with it. It's not going to go away. And it's not like a car payment where if your mom didn't pay, well, she already did, but I just kind of injected some humor into it. But I just kind of told him, listen, I can't just like go repo your penis if your mom didn't make the payment. So I told him, this is real, it's yours, and you can do whatever you want with it, and I said, don't worry about it going back to the way it was, because that's just not going to happen. My success rate is 99%. And I told him, with the technique that I use, that's just not going to happen. I just never seen it go back. And he, and so I called him about 6-7 months later, see how he's doing in college. And he said, Dr. Pham, I have a girlfriend now. I have a job. I'm just happy. And, I asked him, what do you want to be when you grow up? He's already grown, but you guys get the gist. And he said, he wants to be an engineer. And I said, that's awesome. I said, focus on that. And, and he's like, he goes, I can't thank you enough. He said, the fact is I'm off medication, which made me feel horrible, caused me to gain weight and all that. And he goes, now I'm back to the gym. He's like, I just don't know how to thank, to even thank you. And I said, well, you don't need to. I said, I'm just glad that I was able to do something to make you feel better. But the thing is, men don't know that. They don't know that a lot of these issues that they have are actually correctable. And depending on what it is, a lot of them are covered by insurance. And men don't know that. They all think that, if anything that has to do with the penis, it's all considered cosmetic, that's a misconception, and so the point, so this introduction show is just to kind of start the movement and the talk on to get men to really take care of themselves. And then there's a lot of, the show, like I said, submit questions, but there's also been a lot of patients I've seen that I have no idea why the surgery was performed and how it's even done. Like I had a recent patient that, that I'm going to operate on. He's from another state, but I requested medical records. And basically what he had a penis elongation surgery, and they did it under conscious sedation. And for those who don't know, conscious sedation is kind of like, they give you a little bit of medicine. It's not full on intubation. And then what they did was they just made an incision kind of at the top place of his pubic and basically cut half of there's a ligament called a penile-pubal ligament that kind of stabilizes the penis, that allows, when you get an erection, for it to go up. And literally they just cut half of it. And he said, I asked him, I go, well, did your penis get longer after surgery? He said, no, it was exactly the same. I said, well, that's the reason why. That's not how you do penis elongation. And so there's a lot of sham surgeries out there that, it's just not, but patients don't know that. And they end up spending millions, if not billions, dollars a year on procedures that is just not really mainstream or standard of care in the urologic community. And part of this show what I hope to do is kind of these myths and really give at least some clarity, because for me, the show is not so that I need another patient. The show really, like I said from the start, is really just to help men make informed decisions, and as well as to live a healthier lifestyle so that they can live longer and make good decisions on sound science. And I'll leave with this, since this is just kind of our introduction episode. A lot of guys and parents have come in and they all tell me that, oh yeah, because I always ask them, I said, why do you not seek help earlier if you know that you had a problem? They said, well, the doctor kept telling us, oh, it's just, you just have a little fat up here and all that. That is the biggest myth that I've ever heard of. So basically, that fat is something we call the suprapubic fat pad. And that's really an illusion. And what I mean by that is, if you have a guy that's a little maybe heavier set than a guy that's not as heavy, it's just gonna make his penis look shorter. But if you actually take out the measuring tape and you measure it, you'll see it's the same length. If that same guy has a six pack, then it'll just make it look longer. But if you take out the measuring tape, it's all the same. The only way to physically make it longer is with surgery, where I physically move it from point A to point B. So just imagine if you have this and it's out like that and you're heavier set, it just kind of makes it look shorter. That's all it does. The only real way to make it look longer is I physically have to go in there, take down everything that's holding it there, and then re-anchor it so that it's out now. And so that's one of the myths that I don't know how it even got started, and that's why insurance will never cover for you to do a suprapubic fat reduction. That's purely a cosmetic procedure with zero medical benefit in terms of fertility and penetration and all that, versus elongating it because you have a hidden penis absolutely has a medical benefit to it. And the common thinking is, and I don't know if it's true because you hear all sorts of stuff, but the common thinking is a 3-inch erect penis is really all you need to procreate. I don't know about you, but 3-inch, that's no good. And I've never seen anybody after surgery that has 3-inch, but we can talk about that later on, and on other episodes. But today, really, all I want to do is kind of introduce everyone to something I've always wanted to do, which was exactly to educate men. And this could be in California or whatever, but as long knowledge is power, right? So if you know the right questions to ask and all that, you don't need to fly to Houston to have Dr. Pham operate on you. You find there's a lot of good surgeons out there that that can do it. You just have to be able to ask the right questions, and so if it can help a guy in California, Montana, wherever, to me, I did my job. And so, but if if there's a specific topic that people want to hear about, then send it in. And like I said, if I'm not an expert in it, then I will get someone who is. And then, of course, I'm going to bring on guests. I don't want a podcast where all I'm doing is everything from Dr. Pham, because that's just one perspective, right? And so I only focus literally on genitalia reconstruction. That's it. I don't do anything else. And so any other topic, I will get the right person in. So hopefully this was helpful, and I look forward to doing the next episode.
Priceless, take it to the moon. Priceless, one day will be soon. Like it's priceless.